Okay, so we talked about behavior a little bit in class. We talked about the abbreviation TEMP, right? So it's tail, ears and eyes, mouth and posture. So this is Hazel. Hazel is a beautiful little Labrador. She has a little bit of anxiety in clinics and in general certain things. She doesn't like nail trims, she doesn't like hats, she is uncomfortable with like gloves, things that are very abnormal for her in her environment. She doesn't like hovering. Hovering is something I'm going to talk about a lot when we get to our canine restraint lecture. That is a huge problem. Hovering meaning like you're in their personal space. You are standing over them, they're looking at you, you're showing an alpha dominant type of presentation. Do we need to control the environment as much as possible with every breed? Yes. But we also talked about how there's different types of breeds who have different types of thought processing. Like German Shepherd dogs, they got tunnel vision because they're in the herding group. Their goals are to control the environment as much as possible, perform a task, some type of duty, a job. With her having Labrador Retriever mixture is already saying how she potentially is, having her sporting breed mixture. So she has great intelligence already. She can be stubborn, being of a Labrador mix. Her bully breed mixture, she's got more of that. So she's got intelligence, stubbornness. She should technically have agility and grace, which I know she loves her ball. So that's already showing that in there. But also sometimes in the environment, in a clinic, or even at home, like in our house here, she may be potentially uncomfortable with certain things. Like maybe my stethoscope potentially is a trigger. I don't know, we'll see. Her mom has said hats and gloves are really big triggers for her and new people. But I know Hazel, I've known her a good few years, so it's gonna be different in how she perceives me versus how she perceives y'all. But overall, some things that we're gonna talk about that we don't do ever in clinics. We talk about how hovering, one I just mentioned, is something we don't do. A lot of people we talked about don't take it seriously with behavior. They don't look for the signs of discomfort. We talked about displacement behavior. So like if she was licking her nose, licking her lips, these types of potential signs. Tail, her tail is different. It's not the same as a German Shepherd dog. So her tail can tell me a lot when she's doing certain things, how she feels in that moment. So her overall demeanor, right? Demeanor meaning behavior, can be different. Whether her mentation is she is BAR, so bright, alert, responsive, or QAR, quiet, alert, responsive, which is what she is right now. So let's just discuss a few things briefly of what you shouldn't do. So for starters, if she's on the floor, I should not be standing next to her like this and going down towards her. How she reacts, she may just look at me, but looking at her pupils, we know a lot of times they're gonna dilate, showing that she's either excited, she's happy, or she's nervous. She's anxious about something. Right, Hazel? Come here, Hazel. Come here, it's okay, Mama. Good girl. So she approached slowly, even though she knows me. Her pupils are really dilated. So I'm a person in her house who doesn't normally live here, even though when I take care of her, I stay here. So she knows me for that. She is also very much an individual type of dog. She's very independent, yet dependent on her owners. So I'm gonna put her in the corner real quick. So, nope, stay Hazel, come here. So if Hazel was in this corner as a patient, I should not approach her directly. So I shouldn't walk towards her and stand like this or kneel this way in front of her because I'm showing her that I'm confining her. So this is that fight or flight response potential we could see. So with Hazel specifically, she tends to have the flight response to where she tries to be shyful and avoid conflict. Whereas some animals we talked about, they may be completely opposite and they may have only the fight response because they know it's the only way they can possibly survive. We've talked about how biting is typically a last resort for dogs and for cats if they have been socialized. If they are able to avoid that, they will. So with Hazel, I already know by knowing her, she's not going to try and bite me. But if I didn't know her, I assume just in case that may be her only route of feeling comfort and getting away. So if she's in this corner, I should not approach her directly in the corner. Or if she's just standing there, I shouldn't approach her head on. I should approach her at her side. So if she's there, Hazel, will you stay for me? Can you stay? Stay. If she's there, I'm not going to walk up to her Hey Hazel, how's it going? Hazel, I need to hold you in this corner. Come here. I'm not gonna do this because she's already shown she's uncomfortable even though she's wagging her tail. This may not be truthful, so we don't always assume that's proper. If she's in this corner, I know Mama, you're doing so good. Stay baby. If she's in this corner, I would approach her at an angle at the side, and I would approach her like this, and I would come down, and I wouldn't stare directly in her eyes because that can be perceived as a threat. And she's more accepting of this overall, you know, standoff of this moment. Come here, Mama. Come here. You're so good girl. Now she's in the clinic, and I'm going to get her from the lobby, from the reception area, to put her in the exam room, or just to say hi to her, to greet her. I'm not going to approach her like this. She may be okay with it to an extent, but that doesn't mean every dog is. I approach the same. So I approach her at a side angle, and I kneel down a little bit, or I squat down rather, and then I let her smell me. I don't stick my hands in her mouth. I primarily go like this, or I do this number, where I put my hands in a fist to let her smell if she wants to. Especially if she went to snap, she wouldn't get my fingers, she would just get the whole fist, which is bigger than just going like this, where she could possibly get my fingers. Just fun fact that I kind of came up with. Also, instead of approaching her like this and standing to her, looking down on her, I'm showing an alpha position. When, yes, I'm alpha, but remember, we can be subliminal about that and not try and state the obvious to where they feel uncomfortable. So for her, I would approach her slowly, and I would drop down slowly to where I try to be on her level, because most of them are going to be standing already. Even if she's laying down, I'm not standing my normal height, so that makes a big difference there in that gradual change of height. So we could just sit here, and I could talk, and I know her, so we're okay, and she may get up to come check me out. There have been some animals I've worked with, I'll tell you about, who ironically look just like her. Duke looks identical to her, and he was one of the biggest behavioral cases I had, I'll talk to you about later, where everything changed for him, and over 6 months I worked with him, and he does so well in clinic. So I'll tell you about him later. But one of the things, if she was super nervous in clinic, if she wouldn't come to me, if just my presence was a huge trigger, and she was all out body language telling me in so many ways, or even one way that she's that uncomfortable, I forget she's there. So I would just talk to the owner. I wouldn't even look at her. Now we talked about with exams how it's professional, not just to greet the owner, but to greet their pet, acknowledge the pet's presence. On very, not necessarily rare, but uncommon somewhat to a degree, types of visits, ignoring the pet makes them feel better because they feel out of sight, out of mind, and they can acclimate a little better to the environment the best of their abilities. Now having the calming synthetic pheromones like Adaptil we talked about for dogs and Feel Away we talked about for cats can also play a very big role in that. Usually 9 out of 10, not necessarily statistically speaking, but from experience, we see positive results to help them relax in the environment. But I would forget she's there. So sometimes if she was that type of patient, right, and she was super uncomfortable and I had to talk to mom or dad only, not even recognize her presence, I would just stand there, and she may come, she may smell me, she may do all these different things around me, trying to figure me out. She also smells the different odors on me for potential different species, other dogs. The different environmental atmosphere is already a huge trigger for some for anxiety. The different sounds. You're gonna hear dogs in the hall, you're gonna hear them in the areas of the facility, people, phones, people dropping stuff, it happens. So I would just ignore her. And sometimes I would come on the wall. Come here, Hazel. Will you let me? Come here. And I would just do this number, and I wouldn't even look at them. And if they wanted to smell me, you want to smell me? I would just, which she doesn't. She sees her brother's outside the door. There he is. He's crying. But I would just sit here and not look at her. I would be lower so I'm not hovering. And I would just let her smell me if she wanted to. A lot of the dogs will. They'll come up, they will smell you all over, and you just sit there. And your vibes, remember they pick up on that. Positive, negative vibes. If you're super nervous, they're gonna know. They're already nervous, that may make them more uncomfortable. So typically you can just never sit on the floor, but you can just squat there and let them do what they want to feel comfortable. They may circulate a few times and go walk away and sit down, which is what Hazel's all about doing right now. It's just laying on the floor. Right, lazy bum? You lazy bum? Come here. Come here. Come here. Come here. And just letting her have her moment, and she's fine. But also, stethoscopes are a huge trigger for some to make them uncomfortable. Yes, they are, sweet girl. Because they move. Now, when we get to stethoscopes, you'll see what I'm talking about. Wearing a stethoscope and hovering an animal is not okay because they dangle. So they do all this number, and she's kind of looking up, but she doesn't really care that much. But think if she's not in her home, if her mom's not holding the camera, this is going to be very different for her. If we're at a clinic, even though she knows me, she may show discomfort with this. Because when you have her patients, they move. And it clinks, there's metal. So keeping it stationary, taking it off, setting it down silently, quietly, the best of your abilities makes a difference. Also, if you go to use your stethoscope, let them smell it first, which we'll talk about in class. Hi, you want smells? Because they don't know what it is. They don't necessarily know it's not gonna hurt them. They may be exposed to it, but my stethoscope looks a little different. It's got a cover for my neck on it. It's real soft, it looks a little different. But overall, if she can smell it, she may be okay with it if she has proper restraint. So I'd be able to go up to her and talk to her, but I'd have someone restraining her. I wouldn't just go for it. She doesn't like it. She's already looking at it like that's weird. Please don't show me that. See, she doesn't like it. What do you think? It's weird, right? That's okay. Yeah, I know you don't like it. It's okay. We're not going to use it. You're fine. But it makes a difference. With cats, it's going to be about the same principle of all the different things that we do. We still approach them as quietly, softly as possible. You notice my voice isn't super high-pitched with her. Oh my gosh, Hazel, you're a good girl. You're a good girl. Oh my goodness. See, she likes it. But we talked about how some animals are like, absolutely not, you're a freak, get away from me. It's like that crackhead at the gas station we talked about. Yeah, we don't want that, so we need to let them be. So that's more of an issue with very anxious animals, which she's not really right now, but also especially not with cats. So I just talked to her, like, hey Hazel, you're a good girl. I know, you're a sweet mom. And overall, she would do okay. So she's got some anxiety triggers that we'll look at later and try and see if we can help her out in those aspects. Clinic visits, remember, they can be different for everybody, dependent how you handle it, as well as how other people have potentially handled it before you who weren't that great with certain things, who didn't acknowledge the importance of behavior and awareness of the breeds and the breed mixture. So knowing her breeds makes a big difference already, so it's gonna tell me how I need to work with her in different ways, potentially, and I bet you 99% it is gonna work on different things I would do in clinic, knowing her breeds already. Right, Hazel? Well, that's all we have. Yes, you're a good girl. Say bye, Hazel. Say bye. See you later. No jumping.